Thank you, Chairman Van Drew, and thank you to our witnesses for being here today. Let me set the record straight. Obamacare is a complete failure. We are a decade and a half into the so-called Patient Protection and Affordable Care Act, a bill that was promised to the American people as a solution to lower health care spending. But patients have not been protected, and health care certainly has not become more affordable. Since Obamacare was fully implemented in 2014, health care premiums have risen 129%, over 3 times the rate of inflation during the same period. Additionally, premium subsidies have risen right along with the premiums. In 2014, subsidies cost the taxpayers $20 billion. In 2025, that number ballooned to $130 billion and $110 billion increase in 11 years. So if patients and taxpayers have not benefited from Obamacare, who has? Well, unfortunately, it's the large insurance companies. Since Obamacare was signed into law, the weighted average of health insurers' stock prices are up over 1,000%, far exceeding the S&P 500 during that period. In an even smaller time period, since the creation of enhanced premium tax credits in 2021, the Joint Economic Committee pointed out that, quote, the Biden COVID premium subsidies do more to improve the financial outcomes of large health insurers than to reduce health care costs for Americans. The reality is Democrats created a boondoggle that has funneled billions of taxpayer dollars directly from the U.S. Treasury to large health insurance companies, while at the same time added hundreds of billions to our national debt, delivered few results for the American people, and drove premium and premium subsidy costs far beyond inflation. And yet, Democrats demand that we keep injecting hundreds of billions of dollars into the very system they told us would make health care more affordable, despite clear evidence that throwing more money at their failed system is producing harmful results for Americans. Wisconsin common sense will tell you that trying the same action over and over again while expecting a different result is insane. Aside from the insanity of Democrats' position on extending Obamacare premium subsidies, let's talk about the subsidy program integrity, or the complete lack thereof. The enhanced subsidies have given rise to rampant fraud. As we'll hear from Mr. Bagdoyan, the GAO found significant instances of fraud in the premium tax credit program. The system allows insurance companies to effectively get away with stealing from the Treasury. Brokers are paid by insurance companies for each enrollment and are therefore incentivized to enroll as many people as possible. Whenever a person is enrolled or switches their plan, the health insurance company receives a subsidy and the broker receives a kickback from the health insurance company. GAO found that in 2023, there were over 7,000 instances of an already deceased person enrolling in a subsidized health insurance plan. The GAO has also found in 2023, there were over 19,000 instances of a dead person's Social Security number being used to enroll a living person in a subsidized health insurance. In total, for just 1 year, the GAO found $21 billion in unreconciled subsidies. And that number only includes citizens using Social Security numbers. It doesn't include non-citizens who receive subsidized care. Independent research by the Paragon Health Institute estimates as many as 6.4 million enrollees misrepresented their income to qualify for the full subsidized Obamacare premiums. Paragon estimates the cost to taxpayers from this improper enrollment will exceed $27 billion in 2025 alone. This is not incidental. It is systematic risk to a program that has been ripe for abuse from day one. I'm sure our witnesses will elaborate further on that point. Thankfully, Republicans have taken action to combat this Obamacare fraud. In H.R. 1, Republicans ensured only U.S. citizens could receive premium tax credits. We also removed the cap on repayments to the federal government for excessive subsidies and added stricter eligibility verifications to ensure people do not receive generous subsidies before their eligibility is determined. Also, in June of this year, the Trump administration Department of Health and Human Services issued a rule meant to combat waste, fraud, and abuse in Obamacare subsidies. The rule would have gone into effect on August 25, 2025, but a Biden-appointed federal judge issued a stay that prevented most of the fraud protection measures in the rule from going into effect. The judge's opinion was legally and factually ridiculous. The Trump administration rule would have required individuals enrolled in fully subsidized plans to confirm their eligibility or pay $5, a $5 fee. But this judge decided that this easily avoidable fee constituted an illegal premium. The judge also criticized Paragon data analysis and said the CBO study cited were too old. We now know that the CBO's analysis is up to date, consistent across the history of Obamacare, and consistent with Paragon's analysis. In closing, let me just say that Republicans are committed to real reforms that would lower premiums and give patients more choice over their health care. Some of our witnesses are prepared to discuss solutions that could do just that. But Obamacare as a whole, it's broken. After 15 years, it's broken. Despite generous taxpayer subsidies, it has not made health care more affordable, it has not shown evidence of a program that has any integrity, and it has only further enriched large health insurance companies. It is truly the Unaffordable Care Act. Now is the time to wheel our healthcare system back into the operating room and perform surgery, not continue putting billions of dollars in useless Band-Aids on a failed system. Thank you, Chair, and I yield back.